Good morning, and welcome to the Hawaii Health Data Warehouse Coffee Break monthly webinar series. I'm Tanya Lowry St. John with the Hawaii Health Data Warehouse, or HHDW, at the Office of Public Health Studies in the Thompson School of Social Work and Public Health at the University of Hawaii at Manoa. We're going to use the next 30 minutes to introduce you to the Child and Family Mental Health Tracker and Hawaii Health Matters, or HHM. The Family Health Services Division in the Hawaii Department of Health has collaborated with the Pediatric Mental Health Care Access Program to produce the Child and Family Mental Health Tracker. The aim of this online tracker is to make the data more accessible to the public, including researchers and students, public health professionals, policymakers, educators, media, grant writers, community members, and advocates. With the COVID-19 pandemic has really heightened interest in mental health issues, and this Child and Family Mental Health Data Tracker brings together information in an easy-to-review format which focuses on measures that impact women, children, and families. The tracker includes more than 40 mental health-related indicators from multiple state and national data sources, including the Behavioral Risk Factor Surveillance System, or BRFSS, the CDC Places, which is a subset of that, the Youth Risk Behavior Surveillance System, or YRBSS, the National Survey of Children's Health, Vital Statistics, County Health Rankings, and Claritas consumer profiles. The indicators in this tracker are going to be grouped into sections, and these include depression and suicide, child mental health conditions and treatment, attention deficit hyperactivity disorder, parental mental health, adverse childhood experiences among adults, alcohol and drug use, bullying, protective factors, and then access to mental health services. As with our other trackers, the Child and Family Mental Health Tracker contains a toggle at the top that allows users to view the data by different available geographies. The indicators are presented with icons to highlight comparison, data, and directionality, and we'll cover this more in a minute. The tracker also allows users to explore trend data, not just a single point in time, and many indicators include subgroup data by, for example, sex or age or race ethnicity, which allows users to dig a little deeper into underlying patterns and not just look at geography. The maps and charts in the tracker are interactive and can be downloaded to include in other documents. And then lastly, as with all Hawaii Health Matters, the underlying indicator data is updated asynchronously as each new data source is loaded into the warehouse. So this means you won't have to wait 5 years to see updated information in the tracker. Instead, the information will be constantly refreshed. So when we load the 2021 BRFIS and PRAMS data, for example, their information will be updated in the tracker. To make the Child and Family Mental Health Tracker, we created 19 new health indicators in HHM, and we combined these with existing indicators to see what you will see today. They are not all of our mental health indicators in the system, but they're the ones that this group chose to really focus on for this tracker. Some of the new indicators that you'll see that are new to HHM are indicators of depression among young teens and teens, adults, women, depression before pregnancy, and postpartum depression. We also have some indicators on adverse childhood experiences, also known as ACEs. So we have those adults who reported 4 or more, and then individual information about adults who grew up in households with drug use, problem drinking, or mental illness. As we load the 2021 BRFIS data, we'll be adding another indicator about adults who use marijuana. We also have many new indicators from the National Survey of Children's Health. So this only has data for the state, but it's important information about children in our state. So we have information for children aged 3 to 13 with mental, emotional, developmental, or behavioral problems, among children who needed medical treatment but did not receive it, children who had no difficulty, so access to mental health treatment, children with inadequate insurance to cover for mental health care, information about children with ADD/ADHD and those with those conditions who receive behavioral health treatment. We also have information on the mental health status of the parents in terms of parents coping well with daily demands of raising children and the mental health status of mothers and fathers. So before we get to the site, I want to quickly review some of the icons that you'll see. One of the foundations of HHM is to provide data in context. So not only how are we doing, but how do we compare to the nation, to other counties, or how we've done in the past. To help make this clearer, HHM uses a series of icons as part of the display. And as a rule of thumb, the direction of the arrow indicates if the measurement is increasing or decreasing, but the color shows how to interpret it. So red is bad, green is good, and blue is neutral. For trend data, which is when we have 4 years of data, mostly solid icons mean that it's statistically significant. So this is increasing. It's a good thing that's increasing, and that increase is statistically significant. Mostly white trends are not statistically significant. So this is increasing. It's bad that it's increasing, but the increase is not statistically significant. When you see targets in the system, and we have Healthy People 2030 targets that you'll see on many of these indicators, a check means that it has been met, and an X would mean that it's not, and underneath will let you know which target setting mechanism that we're evaluating for the indicators. So let's go ahead and take a look at one more closely. Here we have a pair of indicators from the Youth Risk Behavior Survey on young teens with an adult that they can talk to. And so we can see that in 2021, 74.6% of young teens said that they had an adult they could talk to. That was lower than the prior value, so that's red, and the prior value was 79.8. This is trending downward over time, but this is mostly white, so it's not statistically significant. Among older teens, those are going to be our 9th to 12th graders, it's 73.5% say they have an adult they can talk to in 2021. That is also decreased from the prior value. It is decreasing trend, so it's bad because we want kids to have someone to talk to, and that has reached statistical significance, that the decrease in teens with an adult they can talk to. Neither young teens or older teens have met the Healthy People 2030 target, where we want as a nation that 82.9% of teens would report that they have an adult they can talk to about things that are problems for them. So let's go and explore the system. To get to our system, there's two ways. You can come to our hhtw.org, if that's the easiest one for you to remember, and go ahead and click on Go to Hawaii Health Matters. You can also come directly to hawaiihealthmatters.org. And you'll see here that it's easy to find the tracker now because it's our featured content for the whole month of May. So you can see here it's our featured content, and scrolling down, you can see we have this Focus On dashboard, which will have more information about the tracker, and 4 of the indicators of the 40 or plus indicators in the tracker are shown here. So for the month of May, super easy to find it. After that, the ways to access the data will be coming up to our track progress. You can see here that the Child and Family Mental Health Tracker is the first one in the list. Generally, we do have our most recent first. You can click on the track progress page and you'll see the information here that you can click on. And then also in our system, if you ever want to look at any of our data, if you come to our community dashboard under Find Data, that's where all of the data sort of lives. So you can search by keyword or location or so forth, and all of our trackers are there. So here you can see the Child and Family Mental Health Tracker. It's going to appear the same. So I'll click on this one. And this brings us to the tracker. It has some background information about the tracker. It also points you to a link to a service utilization for substance use, mental health, and crisis care tracker that the Department of Health keeps. So you can go ahead and click on that for more information. They've also provided additional sources of mental health information that you can click on. And after today's webinar, once we get the video done, there'll be a line saying to learn more about how to use this tracker, click here, and that will link you to the video of today's webinar. Okay, scrolling down here, you can see the tracker itself. So we have a list of indicators that are divided up by topic area. So we have our indicators that we have under depression and suicide, indicators for child mental health conditions and treatment, for our section on attention deficit hyperactivity disorder, parental mental health, adverse childhood experience, alcohol and drug use, bullying, protective factors, and access to mental health services. As you're going through and you see the icons, if you maybe need a little refresher for what they mean, you always have access to this C legend here on the side that you can click to get more information about how to interpret them. We also have a help article that you can click on here as well, but that's available to you. Whenever you're in one of our pages and you scroll all the way down and you want to quickly get to the top, you can click on this orange arrow here, and that will bring you back up to the beginning. A couple quick other things with our tracker here. We mentioned that you can change the geography of the tracker. So if we look here at teens with recent depression, this is for the state of Hawaii. That's our estimate, 34.8% compared to the US value, prior value, and trend. If I want to now look at information for Hawaii County, I can go ahead and click there, and the tracker will reset now and will provide data that is available for Hawaii County. So now we'll see here for the teens with recent depression, it's 36.5% compared to that Hawaii value to the US value. But For example, for some of our data, like data from the National Survey of Children's Health, if you scroll down, you won't see that information about children 3 to 17 and their healthcare needs because it's not available at the county level. So that will disappear from the tracker at that time. So you can toggle your geography. If you like the list view that's available to you, you can also change it and look at it as a card view. Again, you can click on these to learn more. You can save the card if you want to use that for a presentation. We also have a colorblind mode. We understand that red and green, while they're easily understandable, are not accessible to everyone. So we have that thumbs up, thumbs down. So this is it's going down, it's green, it's good. So the thumbs are up, but the trend overall is going up. That's bad. So the thumb is going down. So we have those things available to make the tracker more accessible to all of our users. And then we're going to go back and to look at Hawaii data. And you may have noticed as we scrolled through here that they kind of highlight so we can see that there's more information underneath. So let's take a look at one of our new National Survey of Children's Health indicators, and this is children aged 3 to 13 with mental, emotional, developmental, or behavioral problems. And you can see here is the title. This is our standard report. So you've got the title. You can then change the year that you're looking at. If you want to change your indicator, you can click on here and type in another keyword to search. This is our definition. So this indicator shows the percent of children ages 3 to 17 with at least one mental, emotional, developmental, or behavioral problem. We give a brief explanation of why that's important. And in Hawaii, it is 15.2%, and the measurement period was in 20 to 21. And this is maintained by us, and we uploaded this data here in April. And again, we have those icons to help you interpret it. When you're in a report, you can actually hover over the icon and it will give you a brief explanation of what you're looking for. All of our standard reports will start off with a change over time. So here you can see the change over time. You can hover over to get the information on the graph. You can also, whenever you see these 3 horizontal lines, we call it the hamburger. You can click on that and that allows you to do things with that object in the system, in this case, this graph. So you can download it. You can decide you want to put in the confidence intervals on the graph. You can allow a zero-based analysis. And however you configure this graph, then when you download it, you'll get that. So you can download it as a JPEG, a PDF, and you can also download the underlying data. So that's available to you in this system. Next, we have the view by subgroup, and the subgroups will depend on each data source, have different subgroups. But we'll go ahead and click those open so you can see them. And again, remembering our green is good, red is bad. These will compare each of our subgroups to the state population as a whole, and they'll give you that information here. So you can see here that among children who have no adverse childhood experiences, 9.7% had an mental, emotional, developmental, or behavior problems, compared to among children with 2 or more adverse childhood experiences, it's 30.4%. And again, you can see that they are significantly different, better and significantly worse than the state overall. So scrolling down, then you can see that we have the data by age groups for this, also by percent of federal poverty level, and by male and female. Remember that I said that they compare to the state overall. So for something like this, you could see, well, it looks to be there's a difference between males and females. You could quickly turn on those confidence intervals and take a look. You can see that they don't overlap. So females were significantly less likely than males for their parents to report that they had a mental, emotional, developmental, or behavioral problem. So scrolling down in here, you can then see that you can download any of this data as a CSV. The source of the data, again, is the National Survey of Children's Health. And then one of the big things that we have in the system is this related content. So all of the indicators are dynamically associated with related content. So they can be other health indicators, reports, data, resources, fact sheets, our socio needs index suite, and then funding opportunities that we keep in the system. So I also want to highlight this to say, if you and your group are putting together fact sheets or reports that you would like to be able to get out to the public, we are happy to load them into our library, and we can give you reports on how often they're accessed and so forth. But it's a great way to get more information out there about the good work that you're doing. So this is our related content section. So going back up to the top, going back to the mental health tracker, and I'm going to take a look at one of the indicators that we just talked about, which is under protective factors, which was teens versus adults they can talk to. And I want to show you on here that there's another tool that's available in the reports when there's more geographical information. So for this one, we have both state and county data. So you can see you can change the location, the measurement year, and then you can also change it from the state and the county that you're looking at. And scrolling down down on this, you can go ahead and take a look. So these are teens or adult they can talk to. It's 73.5%. We can look at it over time. We see that it's going down. We see by males and females and by grades. And then we can see here for teens who are gay, lesbian, bisexual, or other, 64.6% compared to teens that are straight, 76.5%. So these teens are significantly less likely than teens overall to report having an adult they can talk to. So coming down here, we can take a look. This area will open up for us for our different geographies. So we can see that this data is available by county. We can click on here, and then we get this tool that allows us to look at a map, a chart, and a data table. And as you hover over one, the corresponding information comes in focus on the other chart. So we can see here that Maui looks to be lower than Hawaii. We can go ahead and superimpose our comparison state value, for example, and we can verify that yes, they are different. So Hawaii County youth are significantly more likely to report having an adult they can talk to than in Maui County. We can go ahead and click on here to get to Maui County, or up here, I'm going to go ahead and click here, and then we get that same report, the standard report, but now for Maui County. So you can go in and do some more research to find out what's going on specifically in Maui County. So that's available to you. So I have an activity for you folks. So open up your browsers and use the Child and Family Mental Health Tracker to answer the following questions. How are the depression indicators among young teens, and adults defined? So the hint on there is you want to look at that indicator definition right after the title. What % of parents are coping well with daily demands of raising children? And my next question is were there any statistical differences by subgroup? And what % of adults bought medications for anxiety or depression in the past 12 months? So what is that range by zip code? Those are my questions for you. I will go ahead and start answering these questions. So the first question is, how are the depression indicators among young teens, and adults defined? So I'm going to come back up here and go to our Child and Family Mental Health Tracker. And I'm going to see here, I'll go ahead and click the first one. And so it says that this indicator shows the % of public school students in grades 6 to 8 who have ever felt so sad or hopeless almost every day for 2 weeks or more in a row that they stopped doing some usual activities. So the key there is it's ever felt. So it's sad or hopeless for 2 or more weeks that they stopped doing some usual activity among middle school students, and that was 34.4%. And then among high school students, I know this is going to be related, so I just scrolled down here to click on it for teens with recent depression, and that's the indicators, the % of public school students in grade 9 through 12 who have felt so sad or hopeless almost every day for 2 weeks or more than a row, they stopped doing some usual activities, and this is in the past 12 months. So just so that you know, when you're thinking about these two, one is in their lifetime, so 1 out of 3 middle school students in their lifetime have felt so sad or hopeless at least 2 weeks in a row. And by high school, it's 1 out of 3 in the past 12 months who have ever felt so sad or hopeless. And if we look at for adults ever diagnosed with depression, this is from the Behavioral Risk Factor Surveillance System, and that's going to be who report that the doctor, nurse, or other health professional ever told them they had depression. And you can see this one also has information all the way down to the census tract level because it combines BRFIS and CDC places information, so that can be helpful for folks. And then the next question that we have is, what % of parents are coping well with the daily demands of raising children? And so to come back up to here, I'm going to come back to our tracker, and that's one of our parent mental health, and we have parents coping well with daily demands of raising children. I can see here that it's 51.1%, and we are lower than the US value overall, and that's not good, and the trend has been going down over time. And then the next question is were there any statistical differences by subgroup? So by clicking on this, I can go ahead and expand all of our subgroups, and I can see visually very quickly there's no red or green. One of the things I will tell you is we don't have a huge state sample for National Survey of Children's Health, so it's hard to see differences, but I can go through if I wanted to take a look and see confidence intervals, for example, to see if I see changes and whatnot. But just visually inspecting, I might be able to say that the parents whose children do not have any adverse childhood experiences, 53.8% of them say that they are coping well, compared to only 42.5% on those with 2 or more adverse childhood experiences. Parents of younger children felt that they were coping better. And then parents who had children who did not have special health care needs, it was 52.5 compared to those with special health care needs, 41.6. So we can understand that with more going on, it can be harder to cope with the demands of raising children. And that last question was, what percentage of adults bought medications for anxiety or depression in the past 12 months? And what was the zip code? So I'm going to come back up here, go back to the tracker. I know this is in that very last section, so I'm just going to scroll down quickly. Bought medications for anxiety, depression, it's 13.7%. We are lower than the US value, and we'll go ahead and click on that. This is data from the Claritas consumer profiles, and I'm going to go ahead and look at it by zip code. And then I can see that here is my chart. So one of the fun things is when you see these little arrows, then you can go ahead and sort. So I see it goes from 0 to 18. So I know it's 0 to 18, but I'm thinking 0, that seems kind of strange. I can go ahead and click on one of these zeros and then I can see where they actually appear. This is actually a post office box right here at UH Manoa. So you're not going to have people who say they live here at this place. So this is going to be 0. So it's probably not valid in that case. So I would say I'd probably look and say the 11.7% to 18% would probably be my more accurate estimate of who has that. Here are the answers for today's exercise. Next month, we'll be doing the 2021 BRFSS data, and then in July, we'll be doing the 2021 PRAMS data. Thank you very much for joining us. We really appreciate your time.